Cherokee Health Systems is a federally qualified health center, a licensed community mental health center, and a licensed alcohol and drug treatment center. So we truly are an integrated safety net. And we have been operating in East Tennessee for over 60 years. We are in 14 counties. We serve about 70,000 patients each year.
Many of our patients are rural, geographically isolated, underserved patients. We have a very diverse patient population.
I'm glad Cherokee is here.
And my name is Rob Purcell. I have an appointment today.
I was having a lot of health problems. I had diabetes, 2 hip replacements. I was diagnosed with multiple sclerosis. They stuck with me through all of it.
The elements of PCMH make up the core infrastructure of our organization. The elements that we already had in our system was team-based care, care coordination, continuity, communication, and those became our anchors and the infrastructure for which we basically built an intensive process, a PDSA, Plan, Do, Study, Act, literally every hour. And what we were able to do is use that infrastructure and just take it up 4 times.
Patient-centered medical home, PCMH, is a way to improve healthcare in America by transforming how primary care is organized and delivered. It's comprehensive care, patient-centered, coordinated care with accessible services and quality and safety.
And the most powerful part of PCMH that has been a North Star for us has been the patient at the center of care. Many of the struggles that our patients face have to do with the social determinants of health: poverty, historical trauma, food insecurity, the lack of health insurance. And then comes this pandemic, and it was like a tsunami in a hurricane in the middle of a fire and an earthquake. It was as if the fabric that was already fragmented and frayed had been just ripped apart for everyone.
Like everybody else, I was caught by surprise, but my role was to keep everybody calm. If we're not here as an organization, a lot of patients are going to suffer. Resilience to me is not giving up. We knew that together, as long as we stayed together, as long as we communicated together, we would be okay.
I know we have 8 o'clock patients. If there are questions, please unmute. PCMH requires very strong collaboration. It was already all hands on deck. This was basically about building on that process.
Every morning we would have huddles.
So much was not known at first. How do you protect patients? How do you deliver the care that we needed to deliver? How did you keep our staff safe?
We would put it in order for PPE, and literally we would try to hit purchase, and it would be sold out. Every single day it was, what do we need? How are we going to address it?
We have been doing telehealth since '99, but mainly all office to office. When the pandemic hit, we thought, wow, here's an opportunity to expand services into the homes. 60% of our patient population live in rural areas. It's hard to get cell phone signal. It's hard to get internet. Providers were not used to doing telehealth into the patient home with all the technology challenges.
We did try an initial platform that frankly was a bust, but we pivoted quickly based on input from both the patients and the staff.
We rolled out, we call them Zoom screens, to every single primary care exam room.
Felt like a normal cold.
We did create a virtual health access point, and so patients that did not have the technology to do a telehealth visit can come to like a phone booth, and they would sit down and there would be a screen there to be able to do a Zoom video session with providers.
One of the most memorable experiences of COVID for me was when we initially began receiving COVID vaccine. And it was both just tremendous gratitude and excitement, but then also like, Oh my goodness. We launched Operation Vaccination literally overnight. We've given tens of thousands of vaccines, not just to our patients, but to community members. We also wanted to have a tailored approach to going to some of the most rural and remote areas, to serving our homeless neighbors, to make sure that we weren't just distributing the vaccine, but we were doing it in a way that really was consistent with our goal for health equity.
The support that HRSA provided, it really helped us make it through. We used HRSA funding to purchase a mobile clinic.
Cherokee has a long-standing relationship with CARM.
CARM is actually the acronym for Knox Area Rescue Ministries. Here in Knoxville, there's anywhere between 1,200 and 1,400 people who are homeless living on the streets, and that's who we respond to. When the pandemic hit, we knew that we needed to have people providing the care. Having the bus show up here, having Cherokee go out into the community, bringing the services to the people makes an incredible difference. I knew we could count on Cherokee. They stand for the good of people.
There is a lesson from Cherokee Health System that I really learned to be aware about our community need and do your best to provide the needs. It's not just a job, it's a mission.
Cherokee has always prized innovation. And to be innovative, you have to take risks. You have to be bold and be willing to make big changes. We are never going to go back to a pre-COVID operating state. One challenge, one day at a time, have built an arsenal of things that we can use to engage our community and take care of our patients.
What we realize now is that the resiliency that we had going into this pandemic actually grew and deepened. Whatever happens, we know we will make it through as a team, as an organization.